The nation's top infectious disease expert calls images of a huge pool party in Missouri over the past holiday weekend very troubling.
You have situations in which you see that type of crowding with no masks and people interacting. That's not prudent, and that's inviting a situation that could get out of control.
Backwater Jack's hosted pool parties in Lake of the Ozarks. The owner of the bar and restaurant says medical staff checked people's temperatures at the pool entrance and gave out free bottles of hand sanitizer.
President Trump's approval ratings have plummeted since late February, according to the latest numbers from Rasmussen. As of today, 42% of Americans told Rasmussen they approve of the job the president was doing, while 57% disapprove. That's the lowest in more than 2 years. Back on February 25th, 4 days before the first reported U.S. deaths from COVID-19, 52% of Americans approved of the president's performance, while 47% disapproved. Nursing homes continue to struggle with the rise of COVID-19 cases at their facilities.
And one professor from the University of Chicago who's been studying nursing homes for the last 25 years testified before a U.S. Senate panel with recommendations on how the federal government should help. Joining us now is Professor Tamara Konecka. Professor, thank you so much for joining us.
Thank you for having me.
Quick question. When you saw this pandemic, having studied nursing homes for so long, did you expect this to happen?
So I knew immediately that nursing home residents would be vulnerable to this because they have all the risk factors that people who experience the most adverse outcomes from this virus have. They're older adults who have underlying health conditions. So it was a worry from the start. But I think it took everybody by surprise exactly how much of a trouble spot nursing homes would be.
That answers my question a bit, Professor, but nearly half, as I understand it, of all coronavirus-related deaths in Illinois have occurred in nursing homes. Can you tell us, beyond these comorbidities that exist, why that is and where we're seeing these the most?
Yes. So, one, it's not just the health of the residents in nursing homes, but also sort of almost by definition, the kind of care that they're getting. They are in nursing homes requiring hours of hands-on care every day. And so they basically can't socially isolate, right? They need staff to go from room to room. Some nursing homes have 2 residents in a room. And so, it's also people in close proximity as well as having underlying health conditions. And then, the other part of that is that nursing homes have often been short of staffing, and the pandemic has exacerbated that. And so all of that coming together has made it really hard for nursing homes to deal with this enormous crisis.
We talked to some folks. Oh, I'm sorry. I'm sorry for interrupting. We talked to some folks about a month ago, and they said that the nursing home folks are the ones who are forgotten, and they are the most vulnerable. What kind of recommendations are you asking the federal government to make to help out?
Right. Well, first of all, I think that nursing homes certainly need help. They need help with testing. We need to test all nursing home residents, whether they have symptoms or not, and we need to test them on a regular basis. And then we need PPE, or personal protective equipment, for nursing home staff. We especially need this in nursing homes that serve high minority populations, non-white populations, because our research has shown that those are the nursing homes, just like the pandemic in general, those are the nursing homes that are getting hit the hardest.
What are the challenges when it comes to reporting COVID cases between nursing homes and also assisted living centers? You, I know, touched on that in your testimony.
Yes. Now the federal government is requiring nursing homes to report COVID-19 cases and deaths, as well as the extent of their testing and some other items. And that's really essential because we need to know which nursing homes are in crisis and which ones need help. So we need it in order to direct resources. But we also need it in order to study this problem, figure out what worked and what didn't work. And we need it for consumers. Consumers need to be able to know whether there are COVID cases in a facility they're considering or a facility in which a loved one of theirs already resides.
How hopeful are you that the federal government will bring in resources and help those in the nursing homes? And do you see a timeline for this?
So Congress already allocated some resources to help nursing homes. It's just been slow in getting out of the federal government into nursing homes that need it the most. And so I think time is really essential here, that we need to put sort of more focus on actually getting those resources out, resources that have already been allocated.
Professor, we just have a few seconds left. I'm wondering what you would say to someone who has a loved one in one of these facilities right now.
Yes, well, I know it's a really hard time to be going through that, especially because visitors aren't allowed, and family members often rely on frequent visits not only to, comfort their loved one and to maintain their social relationships, but they also use it to monitor the care that people are getting. And so, to the extent possible, I'd say just keep asking the staff to set up calls through technology. Try to keep up that communication however you can. And on the one hand, you want to monitor things closely and make sure your loved one is doing well. On the other hand, nursing home staff have incredibly difficult jobs that are even more difficult now, and many of them, only mean well. So maybe, cut them a little bit of slack at the same time.
Well, Professor, thank you for your time. Thank you for shining a light on this. I know a lot of folks who have loved ones in these facilities certainly appreciate it. Thank you.
Thank you very much for having me.
Still